Doctor, in short, give us an update on how the national vaccination program is going currently.
Well, I'm very happy with the way it has picked up and the way in which it's rolling out now. There were obviously slow starts and very bumpy at the time when we couldn't get vaccine, and then the AstraZeneca vaccine was found to not be as efficient against the variant at the time, the beta variant. But since we've started with the national rollout at the end of the Sisonke program, in other words, from the 17th of May, things have picked up very quickly, and we've moved from 113 sites on day one to well over 3,000 sites. We are vaccinating in some sectors where whole sectors are being vaccinated, and in some private workplaces, like many of the mines, there are parallel processes that are vaccinating. And then in the community program, everybody knows we started with the 60 pluses, then we went down to the 50 pluses, and now we've just opened for the 35 to 49-year-olds. And so what we are trying to do is have a multi-pronged war on COVID. The first one is make sure you have enough vaccine, and there's a strategy to procure and get the vaccine distributed. The second prong is to make sure we have demand, enough people who want to be vaccinated, and there's always a balance of not leaving the older people behind as we bring the younger people in. The third strategy is make sure that you have enough people and enough systems, the capability to deliver the vaccinations. And then, of course, overarching over that is the decision-making that we are taking and communication such as we're doing here right now. So that's the summary of what we're about.
Now, obviously, you've touched on the additional sites that have been added to the existing program. Just tell us about the teething problems that you are encountering. What are the challenges currently, apart from people's reluctance to actually be vaccinated? What other problems are there?
Well, fortunately, not a lot of people are reluctant to be vaccinated, and certainly when people see loved ones and relatives who are getting sick, they get more motivated to come for vaccination, and seeing friends being vaccinated and having nothing wrong with them also encourages people to come. We do see negative stories which put people off, and some of those are purely fabricated and are overblown on what is going on. That's unfortunate. But the vast majority of people do want to be vaccinated and are coming forward, registering and then coming for vaccination. There are obviously lots of teething problems. It's a massive program. We're trying to reach every corner of South Africa where there are people who want to and need to be vaccinated. And we're using the entire platform of the public and the private health sectors to get there. There are competing demands for our time. There are third wave on the go, so health services we can't move people out of the hospitals to support the vaccination program. So staffing becomes an issue. Mobility with getting around with vehicles and getting to places, and then making sure that we do things legally. Vaccines are a medicine. They are potentially dangerous if they're not used properly. They're injectables, and they have to be kept cold in a fridge, so there's a cold chain that needs to be maintained. It's not like dishing out Smarties or even dishing out simple tablets. Much more complicated than that. So the people who are vaccinating must be properly trained. The people who manage the vaccination sites must be properly trained. They must be using the stock visibility system so that we know where all the stock is all the time. And we must be using the monitoring system so we know who's being vaccinated, with what, when, so that if something does go wrong, we can go back and we have a record of that patient's journey. So in those many moving parts, things do go wrong from time to time, or they go differently from one place to the other, and that creates anxiety for people generally. But on the whole, those are the lesser of our daily experience, and mostly things go very smoothly.
Last week already we saw great interest from the latest group, that is the 35 to I think 49-year-olds. By last week, over 1 million had registered. Many of them have already started getting their jabs. Now, how has this large number influenced the program?
So let's consider some of the numbers. So on the 15th of July, 1 million people registered within 24 hours. And in the next 24 hours, another 500,000, just from that age group. There were people registering on the older groups during that time as well. So if you think of how long is a queue of, for argument's sake, 12 million people if you stand 2 meters apart from one another. It's 24,000 kilometers. So if you were to queue everybody in that age group who qualifies, 12 million people, that's how long it would be. So it's even if half those people came, it's 12,000 kilometers. It's a long way. So it takes a long time to get to people. If we are able to vaccinate 300,000 people a day, 6 days a week, that's 1.8 million people a week, which is the target that we are working towards. And to get to 12 million people is still 6-7 weeks. And if things go wrong, a little bit longer. And we're still doing the 50 pluses and the 60 pluses at the same time. So people need to understand it's months of vaccinating before you get to that number of people. We are aiming to reach 35 million jabs by Christmas.
To expedite the vaccination program in the country, additional sites started operating this week. In the capital city alone, 2 sites have been added to, in particular, accommodate the larger volumes of younger groups that want to be vaccinated. Patricia Visagie, SABC News in Mamelodi, Pretoria.